Hi, I'm Jordan Bond-Gorr from the Gay Men's Sexual Health Alliance of Ontario, and we're here today to talk about party and play and psychosis. With me is our resident expert,
Steph Massey, they, them. I've been working in harm reduction and HIV for over 20 years.
I guess we should probably define party and play for the good folks at home watching this video. So party and play is the intentional use of drugs like crystal meth or GHB with the purpose of extending and enhancing sexual experiences. And crystal meth happens to be a drug that's strongly associated with psychosis. So that's why we're having this conversation today. So Steph, what is the relationship between party and play and psychosis exactly?
Crystal meth is a stimulant, which means it's keeping people up. It releases 3 neurotransmitters, but one of them is dopamine, so feelings of euphoria, but also promotes the release of dopamine and then prevents it from being reabsorbed. But too much dopamine can also lead to mania and hallucinations, but also staying up for days and days at a time. Sleep deprivation can also lead to psychosis. So those are some of the overarching connections between PnP and psychosis.
What I'd like to know is, what is psychosis exactly, and what are its signs and symptoms? Like, how do we tell if we're in psychosis?
Psychosis is often a questioning of what's real around you, or I often talk about like you're not participating in consensus-based reality, and you're having a very different sensory experience than other people around you. So often I find, especially with crystal meth related psychosis, it starts with auditory hallucinations where you hear things that other people don't hear. And then it can extend to other hallucinations for the other senses. For some people it could be a withdrawal, using fewer words, isolation, and also a physical catatonia, a lack of movement in the body. And then for some folks, just remember that psychosis often presents from our cultural backgrounds and also our personal lived experiences.
Is there a connection between people's mental health history and the propensity to develop psychosis?
It's an excellent question, and I'm not a clinician, so I can't give you the most definitive answers. I can speak to my own experience. And there's not one reason for psychosis or link. There's research that shows there might be a genetic predisposition. There's medical conditions and illnesses that can lead to psychosis, substance use as well, environmental factors, stressful experiences, life events, but it can come up for anyone when it's related to drug-related psychosis.
Okay. How long does psychosis exactly last for, and can it become a more permanent condition for folks? Because that's a worry I have.
For most people, once the drug use stops, a baseline should be returned to after 3 to 30 days. That baseline might change though. Experiencing psychosis is not that that'll be erased after stopping to use drugs, and people will remember how they were treated and the experiences they had while they were in psychosis, and they'll remember that psychosis, and what they remember while they were in psychosis may not align with what other people remember, but they still remember it and the feelings they had and the experiences they had with other people. So that also leaves a mark with people. And I would also say that if someone doesn't want to stop using and has experienced psychosis, I would recommend a few days of light use or lessened use, lots of sleep, rest, eating, and then if they are going back to regular use, smaller amounts, smaller duration of time.
And certainly one thing that I keep in mind is I don't want to have to call 911 if I can avoid it. I want to support people in the community. Like, what are your thoughts on that?
Oh, definitely. I never want to invite the police into someone's lives or my own. And I think it can really put our lives at risk when we invite the police in, and also we don't know what to expect when we call 911. If you call specifically for an ambulance, depending on how you describe the situation, police may call ahead of time to clear the scene and make sure it's safe for the paramedics to arrive, especially if it's reported as anything related to drugs. If you are calling the police, I would say if there's other folks there, let them know that the police have been called, and so they have the option of leaving. So I do think, depending on how psychosis presents, that we can try a lot of different tools and strategies with somebody before calling the police. I think calling the police can and should be a last resort. It's not always practical for some people, but also it can really cause a lot of complications in everyone's life if you introduce the police.
So, but what about the Good Samaritan Act? I mean, isn't that there to protect us? And
the Good Samaritan Act offers protection from charges around simple possession and then breach regarding some conditions. So if you're out on a conditional sentence, you're out on parole, probation or pre-trial release, and you are around an overdose, you may not catch charges. However, if you have warrants, If you have tools around you that could imply dealing, so scales, scoops, baggies, flaps. Also, even if you have used paraphernalia, it doesn't mean the police aren't going to question everybody. And they may not charge people then, but they may come back. It just will flag people as uses, and they'll run everyone's names.
So given that like calling the police is the nuclear option, what are some of the things that you would say are signs that you might want to have to go down that path? Like,
I mean, I think it's different for each person based on where you are. Like if I'm renting and someone is creating property damage, if it puts my tenancy at risk, I may want to involve the police earlier. I may want to avoid police because I don't want to flag that for my landlord. Oftentimes in psychosis, people will feel out of control. So are there any ways to offer people a little bit of control that doesn't put your own safety at risk or your tenancy? Are you at someone else's place and can you leave? I think if the person starts hurting themselves or hurting other people, I might consider calling police if I don't have other tools at hand. I think that's one of the big ones, is like the harm
to self, harm to others.
Yeah.
So what do people going through psychosis currently experience when they're seeking care in a healthcare setting, for example?
It depends. I think it depends where in the province you might be trying to access care. And what you look like and how you present. I think there's a different experience of accessing services for racialized folks. I think there's a different experience of accessing services if people are seen as drug users, and if it's reported as a drug-related psychosis, it may not be taken as seriously. There may not be people on staff with the skill or expertise to support people in a drug-related psychosis who may dismiss it and just like, oh, just stop using drugs and then come back, and not see just this. It doesn't matter what causes psychosis. Everyone's experiencing psychosis at that moment. If you're in psychosis, you're experiencing it. That's what you need support with. So I think there can be a lot of barriers to accessing care for people around discrimination and lack of skill set with healthcare providers or allied health professionals, and also a lack of understanding of crystal meth and queerness.
For folks who want to self-advocate for themselves, what are some skills that they can apply in situations like that so they don't get treated or dismissed?
I always suggest bringing a person with you. Even when you're not in psychosis, it can be very stressful trying to navigate a service, especially healthcare. It creates anxiety in a lot of people, and often it's great to have an advocate with you. It's really good if that advocate is associated with an organization, so there's some institutional organizational power. If that person can say they're your worker, because then they can accompany you throughout the whole process. Oftentimes, if you're with a friend, there's a lot of confidentiality issues when accessing care, and so you'll be isolated or removed from that support for quite some time, and you won't be able to have someone with you the entire time. Know what you're asking for, and I often suggest writing down or recording it if you use voice notes instead, what you need and what you're trying to seek and what you're experiencing.
So, I mean, this comes up a lot in our work at the GMSH, but how can care providers counteract stigma and bias in their own work?
I think training and capacity building only goes so far. We need to build accountability into our processes. And also we need to listen to people who use drugs. So acknowledge when we make a mistake, listen to how it impacted people, and then make commitments to changing how we work and owning up to it.
What is a safety plan, and how can it benefit somebody who experiences psychosis?
So safety plans are used in multiple areas of people's lives, and for people in psychosis who may experience psychosis, something you would implement before experience psychosis. So if you have supported people who have experienced psychosis before and you think, oh, maybe this is a good plan for us to do together, or for you to have one in case you experience it again and I'll have one too. You know, you could put it on the back of a door or beside a mirror so it's, you know where it is and it reminds you of what's going on. But part of it is like, who are the people you can trust? Who are the people you can call? And I think bringing them in on that plan, so, and having more than one person always helps, because there's also people who can help you reality test. Like I talked about having people in your circle who agree to like never lie to you, so you can do that reality testing. And then, you know, where you can go, where do you feel safe enough? And who do you feel safe enough with? And what are the tools that you need? So do you have like particular items that you want to have with you? Do you have routines or patterns that help you regain power and feel more in control of your life? But also I think safety plans around when you are partying and there's a bunch of people around, whether it's in your place or someone else's place, what are your safety plans? Do you have transportation? And what happens if someone is in psychosis, you're at someone else's place, and it's the middle of winter and you're not in a big city, so there's not a bunch of Uber. So what are the safety plans for that situation, and you need to get someone out, and you don't want to call police? So there's many facets, and I think one is for yourself or your friends around personal identifying what are the signs and symptoms of psychosis, what steps you need to return to for baseline, identifying what your baseline looks like, and then how you're gonna get there. And a lot of that's just like returning to a basic routine, reducing the drugs you use, and having a support network.
I guess the big question is, what are some things that friends and loved ones can do to show their support for a person going through psychosis? How can they be more supportive?
I think exercising a lot of patience, approaching folks in a non-judgmental way, offering support and comfort with compassion, and avoiding shame, ultimatums, or coercive tactics. Oftentimes people take cues from shows like Intervention or recovery models where it's all about abstinence, or talk about letting people hit rock bottom, so withdrawing all supports. That is punitive, and we can offer support at any point. And it doesn't mean that while someone is using drugs or experiencing psychosis, that they don't deserve love and compassion.
Casey Shapel taught me to say St. Stephen's, which is to think of somebody going through psychosis as being a scared child almost. Like, put yourself in that shoes. You would never shame or like discipline a scared child. You would comfort them. You would offer them comfort and console them and empathize with what they're going through. And to do the same thing when you see somebody in psychosis, because often they're very afraid, right? Like there's somebody following them, there's somebody surveilling them. And that was a good mind shift for me.